Hey, in this video I'm going to show some low back traction and breathing. So I'm going to get a heavy power band anchored onto a rack, or at home a door anchor. I'm going to stretch this to the crease of my hips, and then I have two pillows which are supporting my head and my upper back. And what that's doing is just taking some pressure off the low back. I find if I have no pillows there, it tends to arch the spine, can be uncomfortable for a lot of people. And so play with some pillow support. Some people might need more or less, but if this is uncomfortable, the first thing I would do is change more or less that pillow support, because I want this to just feel like the low back is relaxed. The muscles aren't firing. I'm letting the band pull me. I can adjust my kind of back position against the floor a little bit if needed, but I'm looking for a passive way to unload and decompress the low back. This can help with the blood flow. It can help with some central nervous system desensitization, mainly your brain not protecting the area quite as much. And so this is potentially doing a number of different things, but it's all adding up to hopefully your low back feeling a bit better. To really take this technique and improve on it a bit more, we're going to do some deep diaphragmatic breathing. So I'm going to take my hands and put them halfway on my rib cage, halfway on my abdomen. And when I breathe in, I'm trying to expand into my hands in every direction. So upward as well as outward, as well as down into the floor. And then exhale all the way. So really exaggerating that breath, that can help drive some blood flow. It can help to activate what's called the parasympathetic nervous system, which helps with healing and vasodilation. And so hanging out with traction and adding breathing is often my #1 ways to calm down a painful lower back. Give this one a shot. I usually aim for 5 to 8 minutes, maybe at max 10. And then coming out, I want to just go nice and slow and controlled, and see how you